Kevin. I'm Victoria. I'm a student with SPC.
Hello.
We'll be following you today. I have a patient in room 619. Do you mind giving me an SR report?
Absolutely. All right. Patient room 619 is Mr. Glenn Light. He's a 67-year-old male. He's 5'11", weighs 171 pounds. The attending physician is Dr. Kay Phillips. He was admitted for a diabetic ulcer on his right heel, as well as a flare of his diabetes type 1. He's a full code. Organ system-wise, his lungs were clear, bowel sounds were present, your normal heart sounds with no murmurs. He's alert and oriented times 3. And then all other systems were normal as to be expected. He has a past medical history of hypertension, high cholesterol, and diabetes type 1. He doesn't smoke. He drinks 1 beer a week on the weekends. He is taking Zocor, Neurontin, Humulin, and Humalog. And while he was here, he's getting morphine PRN every 4 hours as needed. All right, he's got no allergies. He's a medium fall risk. His glucose was 290, so we'll be treating that with 6 units subcutaneously of insulin. It'll be the Humalog, fast acting. His other abnormal lab results were a hematocrit of 41.2, so it's just a little bit lower than normal. His red blood cell count was also 4.5, which is also just slightly below the normal. Calcium was 7.4, so that's a little bit low. And his ALTs were high, slightly high, but that's actually somewhat regular in the elderly, so that might not be too abnormal. He has an A1C of 6.5, so that's great. He seems to be a good and compliant diabetic. He's on an 1,800 calorie diabetic diet daily. So we're checking his vital signs about every 8 hours. He was 98.4 with a heart rate of 80, 18 respirations, 95% O2, and a blood pressure of 145/72. We checked that about an hour later and actually went down to 128/70, so he's really doing well with that. His pain scale is 1 out of 10, so he's well controlled. He's got an IV in his right forearm. Let's see what else we got here. He has a history of a benign prostate hypertrophy and transurethral prostate resection 5 years ago. We're still waiting for the recheck of the CBC, CMP, urinalysis, and his AST results to come back. And the heel ulcer, which main reason why he's here, is actually the stage 2. So that's pretty much the story.
Okay, can I ask you some questions?
Absolutely.
Alright, so why specifically is the client receiving this medication that you're going to be giving him, and what action does the medication have on the body?
Well, we're going to be giving him Humalog because he's a type 1 diabetic and his CBG was 290, so he definitely needs something to kind of get him back in normal range.
Okay. And when should you question administering this medication? Does the medication have a therapeutic serum level? Which vital signs should be monitored? And what physiological parameters should be monitored when the medication is being administered?
We shouldn't give it to him if the CBG is lower than normal limits, which is roughly 70 or 80 minimal to about 120. So like if he's on the lower end of that, you don't want to give him this because it's going to bottom out his CBG. You want to check the CBG prior to giving to all the time.
Okay.
You can check for symptoms of like hypoglycemia, which would be headache and confusion, just a lot of neuro deficit kind of symptoms. But that's pretty much it.
So what interventions must be taught to the client to ensure the medication is administered safely in a hospital setting?
You would teach him to make sure that the site is correct. The abdomen is the best choice because it's the fastest absorption rate. And just to make sure that he's always checking the CBG before actually administering, because we don't want to bottom out his glucose.
So what interventions must be taught for taking this medication safely at home?
Okay, you want to teach him to wash the skin, soap and water, to rotate the areas, because you don't want him to get lipodystrophy in that area, and then scarring to where like it doesn't absorb quick enough or well at all, for that matter. So.
And how will you know the medication is effective?
We will recheck the CBG at a certain point afterwards, just to see that it's getting back to normal limits. So,
And that's all my questions
all
for
right,
now.
all right, let's go ahead and meet the patient.
Yeah.
Hello.
Hello.
Hi, Mr. Light. I'm Kevin. I'm your nurse today,
Hi.
and this is Victoria.
Hi.
She's a student nurse.
Hi.
Do you mind if she kind of follows me around and observes?
Fine.
Okay. I have to give you some insulin because your blood glucose is a little bit high. Here, I'm gonna wash my hands.
Okay.
All right. I just want to verify. What's your first and last name?
Glenn Light,
And when's your birthday?
6/10/49.
All right. Thank you. Thank you. Okay. Any allergies to be aware of? No? No?
None that I know of.
How's your pain doing right now? Is it well controlled?
Yes, it's well controlled.
Okay, good. As of right now, is there anything I can get you?
Maybe some water in a little bit.
Okay. All right. Once we get this stuff situated, we'll get you taken care of. All right.
Thank you. Very pretty.
Thank you.
Student
So I'm gonna
nurse
go to the
there.
MAR here. Get this ready. I'll put some gloves on so I can scan the patient. Alrighty here. One more time. What's your first and last name?
Glenn, Mr. Glenn Light,
And when's your birthday?
6/10/49.
All right. Oh, one more time. It can scan for me. There you go. Okay. All right. So we're gonna verify that it's insulin Lispro, Humalog. All right. And we're gonna give 6 units.
Okay.
So the Humalog verified. Alright, barcode scanner apparently is not working, so since it's verified, we'll just go beyond that. Alright, we're going to take a wipe here. We're going to wipe the top of the medication vial, make sure it's clean and free of infection. Alright, we're going to take the insulin syringe, and since we're drawing up 6, we're going to pull the plunger back to that exact amount.
Okay.
Alright. Yeah. Take off the cap. We're going to inject that same amount into the vial, which will help us draw out all the fluid we need. So, pull back to 6. Re-cap here. Alright, I'm going to make sure we kind of flick it to make sure there's no air in there. Alright, I'm going to come on over. Alright, is there a certain place you want us to give this to you at?
No.
Okay, alright. We'll go for the stomach then, because that's the quickest absorption site.
Okay.
Alright, I'm going to go at least 1 inch away from the belly button there. Make circles with the cleaning pad. Inject. The pinch. Inject it. Pull back. We're going to dispose of the properly in the sharps. Alright.
Doesn't feel too bad.
Good. Alright, we're going to come back in a little while. Check your CVG again. Hopefully we'll have had an effect on that, and we'll
What are some
get
side
it situated.
effects that I may be looking for?
The best thing and the most important thing is hypoglycemia. So headache, confusion, any kind of just odd feeling in your head, just let us know.
Okay.
We'll give you the call bell here. If you feel anything like that, just hit it. All right. I'll work on getting your water for you.
Thank you. Ice.
Okay.
I like lots of ice.
Lots of ice? Okay.
Yeah.
All right. We'll get that set up, all right?
Okay. Thanks, Kevin.
All righty. No problem.
Thanks, pretty student nurse.
I'm taking my gloves off. All right. Ready?
So I do have some other questions to ask you.
Okay.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Absolutely. Again, as most things deal with the CBG.
Mm-hmm.
So you got to make sure that they actually need that insulin, because you could really, really cause a problem if they don't need it and you give it anyways.
Okay. And did this information affect your decision to administer the medication?
It did. It was high, so therefore she needed insulin.
Okay. Did this information affect how you administered the medication?
No. It just needed, it needed to be given. So as long as it's in an approved site, it's fine.
All right, those are all my questions.
Alrighty.
Thank you for
All right.
your time.
No problem. Thank you for following me.